Hi, my name's Angela James from Sydney Pelvic Clinic. Thank you so much for joining us during this question and answer session on pelvic pain. Pelvic pain is a topic that we're passionate about here, and one of our missions is to help raise the awareness of pelvic pain so people suffering with it find better help in their journeys earlier on. So hopefully in the next 30 minutes or so you find some information out that resonates with you and helps you along your path. So to start things off, thank you very much to Adele who posted a question on pudendal neuralgia. So Adele's question is, if I don't get any pain relief from a pudendal nerve block, is that proof that I don't have pudendal neuralgia? Does biofeedback work well for pudendal neuralgia? What's the difference between pudendal neuralgia and pelvic floor muscle dysfunction? And does it prove anything if Botox doesn't give you some relief from pudendal neuralgia pain, or could the doctor have done the wrong nerves? So we'll break that down into different parts. So in terms of does it prove anything if you have a pudendal nerve block and no pain relief? Well, it does. A pudendal nerve block is a diagnostic tool. So if you do get relief from it, it means that the pudendal nerve is part of the picture of your pelvic pain. If you get no change in your symptoms after a pudendal nerve block, and that usually lasts between 4 to 6 hours, it does indicate that pudendal nerve is not the major player or a player in your pelvic pain presentation. Does biofeedback work well for PN? So biofeedback really is for pelvic floor muscle, and biofeedback is a device that you can use that gives you feedback about the status of your pelvic floor, and it's mostly used for pelvic floor muscles that are overactive. So you start to see the activity in the muscle and start to use different techniques like breathing, different imagery, and hopefully the little feedback machine shows that the noise of the pelvic floor or the activity of the pelvic floor starts to relax. It's quite a useful tool for people that don't have good internal sense or internal feelings of what the pelvic floor is doing. It's quite handy to have an external device to help you generate that internal feedback. But once you do get that internal feedback and you start to get a better feeling about what's going on in your pelvic floor, you can move away from external sources such as biofeedback. So what's the difference between pudendal neuralgia and pelvic floor dysfunction? Well, both conditions sit under the umbrella term of pelvic pain, and they're both different conditions under that umbrella, but they actually normally coexist. So pelvic floor muscle dysfunction is where the pelvic floor muscle is either too tight or not tight enough, and either end of that spectrum causes symptoms. So if the muscle is too tight, it normally causes pain like any other muscle in the body, but it also can cause bladder and bowel and sexual dysfunction. And it also can compress nerves, so like sort of squeezing a hose. The overactive pelvic floor and deep pelvic muscles can squeeze or compress nerves, and pudendal nerve is one of those. So your pudendal nerve runs from S2 to S4, which is the same area that the piriformis originates from. And the pudendal nerve kind of starts there and tracks through the back of the pelvis, so it sort of runs along the piriformis and coccygeal muscles, and then kind of comes out around the Alcox canal and then runs along the pubic rami. And so anywhere along that pudendal nerve track, if the pelvic floor muscle is overactive, it can give you nerve pain. So although they're different conditions, they often coexist, but you can have pelvic floor dysfunction without pudendal neuralgia, but mostly if you have pudendal neuralgia, you'll have pelvic floor muscle dysfunction. So hopefully that answers your question there. Does it prove anything if Botox doesn't give you some relief from PN pain? Well, again, Botox is addressing the muscle, so Botox is a relaxant or a paralyzer, but in the doses they use for pelvic floor muscle dosage, it doesn't actually completely paralyze. So you normally have some level of function, but it just takes a whole lot of the tension away. So if you did have Botox and it had no change to your symptoms, It more means that the pelvic floor muscle tension isn't the main driver in your pain. So the Botox works on the muscles, which may be leading to pudendal nerve, but if you're talking purely, does Botox prove anything? If you don't get relief, it means that the muscles aren't the main player in your presentation. And your next question, or could the doctor have done the wrong nerves? There are a lot of different nerves in the pelvis. So you've got pudendal nerve, which is the one most people know, but you also have iliohypogastric, you've got ilioinguinal, you've got your obturator nerve, and you've got your cluneal nerves. So there are different nerve roots, and they all can contribute to pelvic pain. So quite possibly, if you haven't had any relief from pudendal nerve block and you feel it is pelvic nerve pain, it may well be coming from other nerves, and you can go about sort of clinically testing for those as well. Okay, so hopefully that answered your question. Thank you, Adele. So the next question was anonymous, and the question was, can a burning urethra be a symptom of pudendal nerve or pelvic pain? Is there anything you can do to help? So burning urethra, or UTI type feeling but not being a UTI, is a really common symptom of pelvic pain, and it may be pudendal nerve pain, but normally if it is pudendal nerve, it's more at the front. So that, again, the pudendal nerve runs all the way from the sacrum all the way forward towards the pubic bone and either supplies the clitoris or the penis. And so sometimes the muscles more towards the front of the pelvic floor can be very overactive, and they can squeeze the more anterior or more front part of the pudendal nerve, and that certainly can give you a burning urethra type sensation. It's often described as a UTI type feeling, but not having bacteria on testing. That's really common. And in terms of, is there anything you can do about it? Absolutely there is. So just like other muscle conditions, if that's the case, so if it's sort of muscle compression at the front of the pelvic floor, restricting the neural flow and giving you burning type pain in the front of the pudendal nerve, then releasing those muscles and taking the pressure off the nerve is a really helpful strategy. Always done to your tolerance, but can be really useful to restore normal sensation around the urethra. So absolutely there can be things you can do. Another question, again anonymous, is pudendal nerve pain curable? It absolutely is. Everything in the body is designed to heal. We are such a clever piece of machinery, and our body's always looking for homeostasis and to achieve balance. So pudendal nerve is just another condition that can occur in the body, and with the right management, absolutely you can get 100% over it. And we've had many patients that's happened with. So absolutely, you just have to find the right mix of management strategies that's going to work for you. So the next question, how commonly do overactive pelvic floor muscles present with bladder and bowel symptoms but no pain? Okay, so that's a good question. So the unique thing about the pelvic floor muscle and when it goes wrong is that it's linked into organ function in your pelvis. So your pelvic floor influences your bladder and your bowel and sexual function. So what that means is if it's overactive, so if the pelvic floor muscle is working too much, then it restricts your ability to empty your bladder. So people with overactive pelvic floor may also experience urinary frequency and urgency, so a strong desire to go to the toilet more often than normal. They can also experience voiding dysfunction, so the inability to empty their bladder, or a delayed initiation of going to the toilet, or a slow flow rate. So that's quite common. Everyone's different, but that's quite common. And often people who know their pelvic pain know that that's the first sign of things getting tight in their pelvis. And it's often not pain, it's often an organ-based symptom versus a pain-based symptom, which is different to other areas of the body, like your calf or your shoulder. Firstly, they're not connected into organ function, but also you get a much more definite sense of the muscle rather than the organ dysfunction. Now with the bowel, it's the same thing. So if your pelvic floor, particularly your puborectalis muscle, is overactive, it limits your ability to empty your bowel. So that muscle kind of tugs the anorectal angle in nice and firmly, and if you can't release and open it, you'll have problems with initiating a bowel movement. Also emptying your bowel, so incomplete emptying, and people can also get pain with defecation. And often patients report pencil poo, so a very sort of thin poo, and that also is indicative of the anal canal not being able to expand and tolerate a decent size feces. So that's definitely a common symptom as well. Everyone's a little bit different, but certainly they can occur without feeling pain. So that's quite interesting and different from other areas of the body. Hopefully that answered your question. Thank you very much. The next question is from Jude. So her question is, I suffer from interstitial cystitis and was reading today that while pelvic floor muscles are important, groin and inner thigh muscles also have an effect on the bladder. Have you heard of this? And does strengthening any of these 3 muscle groups help with interstitial cystitis? Thank you. Okay, great question. Thank you for asking. So Jude, with interstitial cystitis or bladder pain syndrome, those terms are used interchangeably. Often the case is pelvic floor muscle tension. And so what the mechanism around that is as the muscles get too tight, it restricts the blood flow and it may impact the tissue quality in the bladder. And there's some research going on in the States that's actually thinking that the pelvic floor muscle overactivity with reduced blood flow may precede interstitial cystitis and bladder pain syndrome. So that's quite interesting. And it really is telling us the importance of making sure the pelvic floor muscle is not too tight and restricting that circulation to create healthy tissue in the bladder. So the first thing that I'd really like to say to you, please have an assessment, and before you embark on a strengthening program in that area, please make sure that your muscles are able to fully relax and create that sort of blood flow and healthy tissue to the bladder. That's the first thing. The second thing is the groin and the inner thigh. So the adductor muscle group does blend into the pelvic floor. So most muscles work in chains, not in isolation. And your groin or adductor muscle blends into the pubic symphysis and the pubic bone, and the next line of muscles is your pelvic floor. So certainly they can be useful. The other group that you'd be interested in if you're broadening out your management and looking for optimal function around the pelvis is the gluteals. They're a really important muscle to have working well to offload the pelvic floor muscle tension. Again, what I'd really like to say to you is make sure that you are having an assessment, because what you wouldn't want to do is jump into a strengthening and tightening based program if you've got overactive muscles. So you certainly want to make sure you start with release work and then have someone good guide you into the most correct way of rehabilitating the area. But it's good that you're thinking broadly and it's beyond the pelvic floor. So hopefully that answers your question. So the next question from an anonymous source is, what proportion of people with pelvic pain have weak glutes? Okay, that's a great question. We talk a lot about the glutes in our clinic. We're a big fan of that muscle group. And if you do our classes, you'll know the glute burn quite well. So pelvic floor dysfunction and glutes. It can go either way. It's very common for us to assess a patient with pelvic pain to have weak gluteal muscles. It's not always true weakness. Often what we find is once we release the pelvic tension, so the tension on the inside of the pelvis, without strengthening the glutes, the strength can come back into the glutes, which means that there is a role of the tension on the inside restricting the neural flow to the glutes, so it restricts access to the glutes. So it means that it's not true weakness. It's like you can't access the glutes due to the tension and the neural restriction from the muscles on the inside. So that's a really good question. And also, if you have truly weak glutes, so if you're someone that hasn't developed good glute bulk, very common in people that sit down for a lot of the day, then certainly what can happen is the pelvic floor muscle can become overactive in compensation. So it's sort of working too hard to compensate from, missing out on a really important group of muscles that should be stabilizing the back of the pelvis. So that can go either way. And again, what I'd really encourage you to do is to have a good assessment, and then you start to play with releasing things and seeing what starts to change. A very common presentation for us is patients that report they try really hard with their glute training and they just get this sort of non-responsiveness in their glutes. So they describe it like pumping up a tire with a hole in it, and often the case is a very overactive pelvic floor and pelvic sidewall muscles. And once we release those, they have a beautiful response to their training and get that sort of feeling of connection back in the center of their body. So that's a really great question. Thank you for asking it. And it really can go either way. Okay, is there anything we can do at home? Absolutely, wonderful question. Really great to take that responsibility on with your own body. At the end of the day, your body is yours, and it's all about learning what it needs and how to manage it with different symptoms. So we're a huge fan and advocate of self-management strategies and making sure you've got that sense of control over your pelvis, and knowing what things you can do with what symptoms. So hard to answer that individually, so I'm not sure what you're actually working on, but just to give you some ideas, if you have pelvic tension, so either vaginal or rectal, there's a really nice wand that you can use to help trigger point release those muscles at home. It's called a TheraWand, and it can be used either vaginally or rectally. And it's really good to work with your physio to help you best identify the areas that you need to work with and how to correctly use the wand. So that's one home treatment tool. Also, if you're suffering with something like genitopelvic pain or vaginismus, then vaginal dilators are really helpful, which are like little stretching devices to slowly and gradually restore vaginal elasticity in preparation for penetration or pap smears or use of tampons. So that's a really helpful thing to use. Also, exercises, so doing pelvic floor drops is a very common thing that we give patients suffering with pelvic pain or pelvic tension. So learning to release the pelvic floor, and we use imagery like flattening out a jellyfish or ripples spreading to the edges of the pond. We often use pelvic girdle stretches, so stretching out the hip flexors, the groin muscle, the hamstrings, the glutes. That's all really helpful. We use lots of foam rolling for myofascial release. That's really good too. Also managing a flare. So if you start to get your symptoms coming on, like say it's urethral burning, learning some nice restorative poses to help kind of nip it in the butt a little bit to make sure it doesn't escalate. I'm also a big fan of Epsom salt baths too. That can be really helpful with your pelvis soaking in magnesium salts. It's a really relieving thing to do with the first onset of pain. So lots of stuff you can do, but again, I'd really encourage you to tailor your home program with your pelvic physio so it's meeting your needs the best it can. But great question, and encourage you all to take that ownership on. Wonderful patients improve a lot more when they do, so that's a good point. So then the next question is, if sexual intercourse with my long-term partner is painful, should I just ignore it? Will the pain go away on its own? Okay, wonderful question. So you shouldn't ignore it, and I think you probably know that because you're asking the question. So if it was going to go away on its own accord, it would have already. What can happen is if you continue to have painful sex, your body starts to learn to protect itself. So those little pelvic floor muscles act like a bouncer to your body, and before penetration they start to guard because it's learnt that the next step is painful. So the muscles get tight therefore the elasticity reduces and therefore the pain would probably get worse, and that turns into a vicious cycle, and before long the activity is off limits. So I certainly don't recommend ignoring it. I would really encourage you to come in and see a pelvic physiotherapist so they can assess the level of tension in your pelvic floor and set a management plan so you restore your normal vaginal elasticity and you can go forth and have pain-free sex again. But it's great that you actually, that you know that that there's probably something going on in your pelvic floor, and we would really love the entire population to know that painful sex is often related to overactive, tight pelvic floor muscles. It would really help a lot of people out if we have a general understanding around that. It's unfortunate, but a lot of people wait for years until they present, and it's a condition that we can generally successfully treat within about 6 to 12 weeks. Tell all your friends about that. How do I know? The next question is, how do I know if my pelvic floor muscle is weak or tight? If it's tight, is it weak? Okay, another good question. So it again comes down to an assessment. However, if your pelvic floor muscle is tight, it has a restricted range of motion. So that means it can't move as much, and if it can't move as much, it can't generate the same power. So that's called a length-tension relationship. So we're most strong when our muscles are long and we're in the mid-range of that. We can't generate pressure or tension if our muscle is shortened. So that's the first part of the question. But also the second part of that question is sometimes with some patients, you release a tight pelvic floor muscle and it's naturally able to regain its strength and move through range and generate power. But sometimes, probably most of the time, is that you release the muscle and you've got the length available, but then you need to move on to more strength-based activities to regain its full function. So again, it does come down to an assessment and working with a good physio to help you know what's what and what to do about the different things. But good question. Okay, so the next one is on male pelvic pain. So someone wrote 5 questions in a row. So the first part of the question is, so this is not a bacteria lurking around somewhere and no one is able to detect it. All right. So this is to do with a condition that was previously known as prostatitis and more currently known as non-bacterial prostatitis and more simply known as pelvic pain or chronic pelvic pain. So in most cases, and I'm talking about 98%, that's the new statistic from the American Urological Association, is that this condition is nothing to do with bacterial infections in the prostate. Okay, so if you've had some tests and there's no bacteria, and that's 98% chance that there won't be bacteria. So hopefully that answers the first part of the question. Question 2 is, so you're not telling me my prostate is not the problem. How come I can feel something inflamed inside and pressure against my suprapubic region like my prostate is pushing out? So in most of the cases, the prostate is not the problem. It's really common for patients with pelvic pain to report a pressure-like feeling. Some people say it feels like a golf ball inside, but pressure inside is really common. And commonly it is around the suprapubic or the bladder region, which I can understand why it would be reported like prostate pain. And the muscles, when they become really tight, they do have some level of inflammation and they can feel like something's bruised inside. But all of those symptoms can be, and most likely are, to do with a very overactive pelvic floor muscle. and it can create irritation to the tissue. So it can create irritation to the prostate and irritation to the bladder, but mostly those organs are not the problem. It's the muscles around the organs that are the issue. Okay, so hopefully that answers that. Question number 3, why do my hands, feet and legs hurt, and am I crazy? Okay, you're not crazy, but your nervous system is upregulated. Okay, now what that means is that your peripheral nerves, so the nerves through your body, so in your hands and your feet, your legs, are overactive, and that's because you've been in pain for a significant period of time. And most of the time it's because you haven't had good management yet. So you still aren't seeing the light. So you're not sure where the end of the dark tunnel will be. You may have tried lots of different medications. You may have been to lots of different health professionals, and you don't feel like you are getting the answers that you need to help you address and move forward from your pain. So because of that, your brain becomes extremely worried and concerned about your symptoms and your future. So then your brain becomes very busy and preoccupied with your current situation. And so it's no longer available to help down-regulate or turn the volume of your peripheral nerves down. So you get this upregulated nervous system where everything gets pretty noisy and you've lost your ability to modulate it. So that's why those symptoms can really come on, and that's definitely a symptom of central sensitization. Now, I would like you to know that that's completely changeable as well. And one of the biggest things to start that down regulation is understanding the processes at play in your body. So what's going on in the pelvis, but also what's going on in your nervous system. And once you get a clearer narrative around that, things will start to settle down, and it's very important that they do so that you can get into the zone of recovery and healing. So great question, thank you for asking. Number 4, what is the solution? Is this treatable, and can I become normal again? Yes, you can. What is the solution? The solution and the treatment, again, I'll go back to the education. So understanding the processes at play in your body will reduce your fear and start to tone down that nervous system, which is really important so we can access that rest and repose or parasympathetic component in your nervous system. And that's where your tissues start to heal and recover. And then in terms of treatment, again, individual assessment's so important to work out what's actually going, array in your body, but it's typically a combination of addressing the internal tension. So with male pelvic pain, it's rectal releasing and pelvic floor muscle down training, and really getting you to connect to what it means to release your pelvic floor and drop it and not hold so much tension. Restoring normal bladder and bowel habits and function, and addressing anything that's come up in the external pelvis. So if you have tension or issues in the pelvic girdle, any other kind of influencing factors, and getting a really good home management program happening so that you can address the tissue dysfunction on a daily basis when you're in quite high levels of pain. So it's an integrated approach, but education, targeted management, and self exercise or home exercise program is the way forward. And deciding what your goals are and kind of getting towards the big picture and moving you back to the things that you love doing in your life is a really important part of it. And that's how you restore your pelvis and become normal again. So really good question. Now the next one. Have you treated people with excruciating pain for years, and have they become normal again? So absolutely I have. One of my motivations to do things like this in creating awareness is I hope that we improve the general awareness and conversations happening out there about pelvic pain, so people can find help earlier in their journeys and not get to these sort of peak points of pain where life is really put on hold because of it. one of the issues with pelvic pain is because we don't have good understanding in the general community is that you don't get led to pelvic physiotherapy early enough. You have really good understanding around sports physio, and you know, if you sprain your ankle, you know what to do, or if you have back pain, you know what to do. But pelvic pain can be this really confusing set of symptoms that may not feel muscular on the outset, and it may filter you into a significant amount of specialist appointments and testing, and often without outcome, because the issue's not in the organs, it's in the tissues, the surrounding muscle tissues. So I'm diverting a little bit from your question, but the answer is absolutely yes, and part of the motivation to do this is to help people find better help so they don't get to those peak levels of pain. But even if you are at that peak level of pain and life is really put on hold because of your pelvis, you absolutely can still recover, and we've got hundreds of patients that have been through that journey. I wish that I could have them here right now talking to you to give you that reassurance, because it's really helpful to hear it from people that have walked your path, but certainly you can. Okay, so the next question is, does meditation alone help symptoms? So meditation is good. We've talked about the nervous system already and the importance of down regulating the nervous system and getting into that parasympathetic rest and repose function to help those tissues heal and recover. But alone, I would not say that meditation alone will cure things, but in amongst the right plan, addressing the tissue dysfunction and understanding the pain, moving more, etc. Meditation is a good component of that integrated plan, and it's really looking at that down regulation of the nervous system and making you less reactive to the pain. So there's some really wonderful techniques that you can use, and we actually we use meditation a lot in our clinic. We've got a wonderful therapist, physiotherapist, Felicity, and she runs a great Physio Restore seminar, a workshop actually. It's on once a month, and it's specifically for pelvic tension, and you learn a lot of techniques around down regulating that nervous system, taking the charge out, and she gives you a wonderful home practice that you can carry on with. So certainly a great component to have, but not in isolation. Okay, the next question. What portion of people overcome their overactive pelvic floor symptoms? What is the usual recovery time from start of treatment? Okay, so everyone's interested in the cure rate, which is wonderful. I think the main thing to keep in mind is that we're talking about muscles and nerves, and our body is highly adaptable. It is adapting to what is in your environment at this present moment, and there is a massive potential for change at any point. So in terms of what portion of people, given the right management plan in place, I would say 100%. If there's something missing in your management plan or something that's a barrier to your treatment, I'd really like to explore that and see if we can break that down. But if we're talking about muscles and nerves, we can adapt and we can heal, we can improve, given the right plan. In terms of the usual recovery time, that's a really hard question to answer, as it's very individual. So to give you an idea though, say with a condition like genitopelvic pain or vaginismus, so the symptoms of that is for the female, the inability to tolerate penetration. We would normally see that person twice a week for 6 weeks. Sometimes people take a little longer, and sometimes people take a little shorter. So, but around the 6 to 12 week mark is a good ballpark figure. Most things have healed within that time. If you think about a broken bone, it heals within about 6 weeks. And certainly having home exercises can fasten those things along. But I will say, with patients that have had their pain for years, and we see chronic pelvic pain a lot, so we're talking 5, 10, 15 years, if the nervous system is really upregulated and there becomes a lot of factors involved in the pain, it will take longer. So, but 6 to 12 weeks is probably a good ballpark figure, but they're outliers. Okay, so the next question is from Emma. Thank you, Emma, for giving us your name. Your question is, you have hypermobile syndrome. Recently, I got sudden onset of non-pregnancy related SPD, PGP, and SIJ dysfunction. So that's symphysis pubic dysfunction, pelvic girdle pain, and sacroiliac joint dysfunction. I'm continuing my usual exercise regime with limits, but the pain is severe. I'm worried I might need crutches, or I may develop new chronic pain problems as I can't take my mind off this pain. Do you think pelvic support belts and crutches are useful, or do you think these just encourage key muscle supports to switch off? Okay, great question. So hypermobility is a reduction in collagen integrity. So your tissues have too much stretch, and that can become an issue in the pelvic girdle, which needs a certain amount of stiffness to keep it stable. So certainly it's great that you're exercising, well done, and carry that on as best you can. The long-term way of managing hypermobility is through muscle training. So the muscles, if they're trained correctly, can compensate for the increase in stretchiness in your tissues. So keep working on those muscles. You mentioned that you're not able to take your mind off your symptoms. I would really draw your attention to what happens with your nervous system when you become fixated on your symptoms. They become worse because you're giving it a significant amount of attention, which means you get an amplified response in your body. So in addition to your training, muscle training, I would really encourage you to look for things that can help down-regulate your nervous system and reduce that fixation on your symptoms and worrying about the future, because unfortunately that makes your experience of your pain worse. So I'd really like to encourage you to look at two avenues there. Wonderful, you're exercising. Keep going. Hopefully you're working with someone good that can help manage the bumps and give you modifications and keep you moving, but also start to really look at that nervous system component as well, because that will help. And in terms of your pelvic support belts, they are a useful thing to do. There is evidence to show that when you put a pelvic support belt on, there is a reduction in your own muscle activity. So it's important to use it sensibly. But for example, say if your pain gets worse towards the end of the day, then you put your belt on towards the end of the day. So if you get a functional gain from wearing a belt, then we think it's a really good idea, but just using it sensibly. So you're not using it all the time, you're not overly reliant on it, and you're not sort of squeezing that belt too tight. It should be on just like a firm shoelace, so that you are still using your muscles alongside of it. But yeah, if you're in pain, please don't be shy. You use that belt, but just use it in a tailored way. Good luck. I hope you come through where you are at the moment. Okay, so the next question: how many physio appointments do patients attend on average when seeking help for overactive pelvic floor muscle symptoms? How frequently do you usually see these patients, and how long months do these patients usually attend physio for? So I think we've probably already answered that one, but typically 1 to 2 times a week between 4 to 8 weeks. We really combine our management with home exercises and strategies so that you're continuing your rehab and taking control of your symptoms, which is really important. But that's probably a good ballpark figure. But again, it is individual, and you'd really need an assessment to get that more targeted to you. Final question: once someone has sought help and recovered from overactive pelvic floor symptoms, what is the likelihood of these symptoms returning, and can this be prevented, and how? Great question. So yes, in terms of recurrence, if you do a really good job in your management and you re-establish normal balance in your pelvis. So you've, shared the load, you've reduced your pelvic floor muscle activity, you've picked up your glute function, your deep tummy's working, you've learnt how to manage your posture, so maybe you're not tucking your tail under all the time and squeezing your gluteals. You've learnt how to address early signs of pelvic tension, so you jump on your roller or have your Epsom salt bath. You have learnt how important it is to not sit all day. You know that your pelvis loves movement, and you've started to put these into place on a daily, weekly, monthly level. Then it's unusual, very unusual, to return to where you begin with your pelvic pain. Sometimes you can have bumps along the road, but you rarely need the intensity of rehab that you do at the start, because your brain also knows what's going on. So one of the biggest things is you don't worry as much because you know exactly what's going on, you know what to do early, and you get on with doing what you need to do, versus the cycle of chasing medical professionals and unsure and all that stuff that happens at the start. You've walked that path. You know where to get to earlier. But then there's certainly some conditions that we see very, very, very little recurrence. So genitopelvic pain is a good example of that. So once the patient has recovered, restored her vaginal elasticity and has moved on to intercourse, pain-free intercourse, providing she stays in a relatively regular sexual routine, which most people do once they can, we hardly ever see those patients again, and it's really wonderful to observe. They often move towards pregnancy, and sometimes we see them in our pregnancy classes, and we often do more release work just before they deliver their baby to make sure their pelvic floor's got that full elasticity for second stage of labour. But yeah, often they don't recur at all in terms of the genitopelvic pain symptoms. So thank you for asking that question. Okay, well that's really the end of your questions. I'd really thank you very much for contributing and asking the questions that you've been wondering about, and hopefully I've done a pretty good job at answering them and helping you along your path. If you know of anyone suffering with pelvic pain, or you think would benefit from listening to this video, please feel free to share it, and stay in touch via our Facebook page, Sydney Pelvic Clinic. And we'll let you know if there's any other future events. And yeah, I hope you enjoyed tonight's session.